Hi, I'm Dr. Janet Pope here at Room Now at ACR 2024 in Washington. I want to talk about a big important question is, are we under monitoring in scleroderma associated ILD? What do I mean by that? There's no consensus when your patient has clinically relevant interstitial lung disease of how frequently to do the pulmonary function test. So abstract number 0678 was actually a nice way to answer this question. So this was a sub-analysis of the census trial. So these were, to reorient you, patients with clinically relevant scleroderma ILD that was progressing or had pulmonary fibrosis, and they were randomized to get nintedanib or placebo. And it was added to standard of care, which might have been MMF or no other care. And what they looked at now in the sub-analysis was what proportion at various time points would be progressing in their ILD. And a bit shocking to me was 25% of patients had worsened their FVC, their forced vital capacity, by 6 months. Well, what does that mean to me as a clinician? If my patient has scleroderma-associated interstitial lung disease that I think is clinically relevant enough to want to treat the patient, I think we should probably be doing every 6 monthly pulmonary function tests, because if they're worsening, I'm going to add or change therapy. So I thought that was clinically relevant. That's not all patients with scleroderma, it's those with ILD that you think is clinically relevant. There's one other shout out if we're going to talk about the lung and scleroderma. Abstract 0706 looked at pulmonary arterial hypertension. So there are yet again new guidelines, and the question was, are scleroderma patients with pulmonary arterial hypertension, how do they perform with these guidelines? And sadly, they perform equally poorly compared to the old guidelines, because a lot of our patients are mixed. They have pulmonary arterial hypertension, a bit of left ventricular diastolic dysfunction, some ILD, so it's hard to know what group they're in. So we'll keep our eyes on this space, and I will change my practice doing PFTs more often in my scleroderma patients with real and important clinically relevant ILD. Thanks, and join us for more news. Thank you.